So starting with the asymmetrical tonic neck reflex, our onset age is going to be birth, integrated is going to be 4 to 6 months. For procedure, you're going to want to lay the infant supine and turn their head to the side. So depending on what way you turn the head, face side, your arm and leg are going to extend, while skull side, your arm and leg are going to flex. For a negative response, you just won't see what I just stated. Tonic labyrinth reflexes, onset age birth, integrated age is 6 months. For this procedure, you're going to lay infant either in the prone or supine position with their head in midline. For this, we're really looking at muscle tone. So for positive, if they're in prone, you'll see increased flexor tone. But then if you lay them supine, you will see an increase in extensor tone. Negative response, you just won't see any muscle tone at all. Symmetrical tonic neck reflex, onset is going to be 4 to 6 months, integrated is 8 to 12 months. Procedure, you're going to want to lay the infant in the quadruped position, and you're going to flex or extend the head. For a positive response, if the head is in flexion, your upper extremities are going to flex with it, lower extremities are going to extend. If head is in extension, upper extremities are going to extend with it, lower extremities are going to flex.
So for the protective extension reflexes, the first to develop is downward. It's going to develop around 4 months old and it will persist through adulthood. You'll lower the baby towards the surface. In positive response, they should extend their arms to catch themselves. In negative response, they will not, and they will allow themselves to hit the surface. The next to develop is forward. It's going to onset around 6 to 7 months, will also persist through adulthood. The baby will be seated for this test and you will push them forward. They should extend their arms to catch themselves in positive response. In negative response, they will not, and they will allow themselves to fall forward. The next to develop is sideways. It will develop at 7 to 8 months, also persist through adulthood. The baby will be seated and you can push from either side. They should extend the arm to catch themselves from falling. In positive response, in negative response, they will not extend and they will fall sideways. The last to develop is backwards, and it develops around 9 to 10 months old. It will also persist through adulthood, and then you will push the baby backwards. They should extend their arm behind them to catch themselves in positive response, and in negative, they will not and fall backwards. Okay. The first tilting reflex to develop is prone. It will onset at 6 months old and persist through adulthood. With the baby lying in prone on the ball, you'll tilt the ball towards the ground. In a positive response, the baby should laterally flex their trunk towards the opposite side to maintain their balance on the ball. The next to develop is supine, which will onset at 7 to 8 months old. It will also persist through adulthood. With the baby lying on the ball in supine, a positive response, the baby should laterally flex to not fall off the ball. And in a negative response, they will not laterally flex and they would fall off the ball. The next to develop is sitting, which also onsets at 7 to 8 months old. This will also persist through adulthood. With the baby sitting on a flat surface, you would lift one hip. In a positive response, the baby should laterally flex the trunk to stay upright. In a negative response, the baby does not laterally flex the trunk and would fall in the direction of the tilt. The next to develop would be quadruped, which will onset at 9 to 12 months old and will also persist through adulthood. With the baby on the balance board, in quadruped, you will tilt anteriorly. The baby should flex their legs and extend their arms in a positive response. When tilted posteriorly, the baby should flex arms and extend their legs. And when tilted laterally, they should flex the arm and leg on the higher side and extend the arm and leg on the lower side. In a negative response, they would not flex the correct leg and they would lose their balance on it. The next to develop is standing, which will onset at 12 to 24 months and also persist through adulthood. Standing on the balance board, in a positive response, the baby should flex the leg on the higher side and extend the leg on the lower side to maintain their balance. In a negative response, they would not flex the correct leg and they would fall off.